everything might not be fun.
The politicians keep saying, why is our healthcare system so expensive? And like, duh.
How does that make any sense?
We'll figure it out. This is the thing, I'm just getting totally unhinged now, and I don't know what to do.
How are you? It's a little bit windy, so I might talk loud. I wanted to talk about something we've kind of talked about a little before, which is the idea that everything we as doctors are doing is backed up by science. And I'll give you a few examples. We know, for instance, that taking calcium does not help your bones at all. I can't tell you how many studies have shown that. Not only studies, but also what we call longitudinal studies, where they follow people for many years, like the Women's Health Study. And people who take calcium don't have any less fractures or fewer fractures than people who don't. We know that. And yet every doctor who I see that my patients go to for their bones puts them on calcium, says you have to take calcium. Some of them measure the calcium level. They say it with a scientific aura about them, although we know it's a bunch of bull. And the patients believe it. I have to explain it to my patients because it doesn't make sense that calcium wouldn't work, because bones are made of calcium and they figure it'll work, but it doesn't work. It's just that simple. Another one I've talked about is a drug called Zetia. Zetia, which is a multi-billion-dollar drug, is used to lower cholesterol. And it does a great job of lowering cholesterol, except it doesn't help people one bit. It lowers the cholesterol, but it doesn't prevent the cholesterol from sticking to blood vessels. So people on Zetia have no fewer heart attacks or strokes or anything else than people not on Zetia. Their cholesterol just looks better. And the doctors are all excited about this, and the patients and everyone. We've talked about this. It's kind of like a doctor that puts you on Zetia is kind of like a doctor that you go to with a big gaping wound. And you look at the doctor and say, what are you going to do about the wound? And the doctor puts a Band-Aid on the wound and says, look, the wound is gone. I'm done. Look, we've achieved that. That's all Zetia is. It makes the number look better. It doesn't help the person. And yet it's multi-billion dollars. Doctors are using it like crazy. Drug reps are selling it like crazy, and the doctors just use it. I was in a meeting recently where we're trying to talk about cardiology. And one of the big sticking points is how much money is being spent on stress tests. Some of the cardiology groups in my town do them every year on everybody, regardless of symptoms. Even the cardiologist in the room said, well, there's only one reason for that, and that's to make money, because they make a lot of money on these tests. This is the kind of test that I've told you is costing the system hundreds of billions of dollars, hundreds of billions of dollars a year, without demonstrating any benefit to anybody other than the cardiologist. And no one's checking this. The insurances continue to pay for it. It's a big money business. So we were talking about how to curb the use of stress tests, and some of the doctors in the room, primary care doctors, said, you know, why don't we go with the fact that cardiologists should follow the American College of Cardiology standards. The American College of Cardiology is a group of cardiologists, and we've talked about them, that have big meetings every year and come up with standards of what makes good medical care. And they feed these back to the cardiologists. These are the guys who say everybody should be on statins, and they don't talk about diet and exercise. These are the guys that say everyone should be on anticoagulation even if they fall and bang their head all the time. These are the guys who do it. These are the guys who lowered the blood pressure standards so 30 million more people have hypertension and are sick and can now see doctors. These are the guys. So a recent study came out, and we've talked about this. It shows that the American College of Cardiology standards are not backed by any scientific fact. In fact, only about 10% of what this big authoritative group says has any science to back it. And when I've looked at that 10%, even that's very questionable. That 10% does not, for instance, apply to older people who I usually take care of. In fact, almost nothing they say applies to the people I take care of. And yet the cardiologists just buy it hook, line, and sinker. They listen to what their group says. They don't question it. They just do it. This is why they put people on Zetia, because the American College of Cardiology likes them to lower their cholesterol. This is why they have a religious fascination with drugs like Eliquis, which is one of those blood thinning drugs that kills more people than it helps. Why the lawyer ads are always on about Eliquis. Similarly, the endocrinologists, their society wants everyone on calcium. Again, there's no scientific basis for this, but these doctors, by the way, they don't make any money by putting people on calcium, but they do it because they think it's right. They don't look at the data. The reason I'm bringing this up is because as I hear more and more doctors talking about we should look at these guidelines and those guidelines and go with what this group says and that group says, the more we see that these guidelines are a bunch of trash. Here's another crazy thing. A lot of the big institutions that we're talking about, we've talked about groups like the American Diabetes Association, the Alzheimer's Association, the CDC, Centers of Disease Control, even these groups like the cardiology groups, they get a lot of money from drug companies, a ton of money. And wonder why they're recommending everyone to be on drugs. What a big surprise. But yet, everyone's buying what they say. It's really important for us as thinking doctors and for you as thinking patients to question all this. We've talked before how there's very little evidence that almost anything that doctors give you makes a big difference in your health in terms of chronic disease. Yes, we want to treat diabetes and hypertension reasonably, not aggressively. The guidelines for diabetes are crazy. I mean, there's no evidence that lowering a sugar below 200 helps. And we're telling people they have to get it below 100, which we're maiming and killing more people than helping them in that case. And of course, we're creating the diabetes epidemic by expanding the definition of what diabetes is, adding millions of people to the diabetes roll, and saying, my God, we have an epidemic. We got to use more medicine, see more endocrinologists, do more tests. This is what we're doing. So I think as a patient, you have to go into the doctor's office with a sense that you don't have to be as aggressive as the doctor seems to think. Higher blood pressures are okay. Everyone's going to have high blood pressures sometimes, especially when you go to a doctor's office. That's when it's the highest. Well, a dentist. A dentist is really the highest, but doctor's offices are pretty high. I usually sneak the blood pressure cuff on my patients when they don't know it's coming. And I get better blood pressures that way. But regardless, we have to take a lot of blood pressures and then be reasonable. We don't care if it's any lower than 150. If you're going at 150, you're good. In most cases, some patients need 180. Some patients would benefit from lower blood pressures. It's patient to patient. Their guidelines are not that way. They're generic. And when your doctor tells you to take calcium, when your doctor tells you to take Zetia, you should turn around and walk out the door, because that means this doctor does not have any basis of scientific knowledge, has not looked at any studies, does not know what he or she is doing. It's really that simple. Protect yourself as a patient. If doctors followed actually the science instead of the guidelines, we would not have a healthcare crisis. We can afford to insure everybody in this country and still save hundreds of billions of dollars. Bernie Sanders, you want Medicare for all? You better start talking to the people who make the guidelines, and then we can afford Medicare for all. If you give Medicare for all under the current way things are done, status quo, we're going to bankrupt the country. So Bernie, think about what you're doing. I'm a big fan of everybody having insurance, but not when the clowns who pose as doctors are doing this kind of stuff. We need to rein in all this abuse, and we have to start practicing medicine based on science, not based on snake oil that we disguise as science. Nice day down in the water. Hey, so if you're equally annoyed by our dysfunctional healthcare system and all the garbage you're being fed, then give me an email, log on to my website, which is listed down here. Let me know what you want me to talk about, and I'll just keep feeding you information, and we'll discuss this and hopefully make some changes. See you later.